All right, so in this video we're going to cover a 90-90 hip lift. This drill is related to essentially learning the skill of how to create good core stability through positioning your rib cage and your pelvis, and then managing pressure once we've positioned the rib cage and the pelvis in a more ideal posture, we could call it. So for this drill, you're going to need a wall that you can put your feet up on. You're going to need a ball or something that you can squeeze between your knees that's roughly about this diameter. A towel roll is there as necessary. This is really just for head support, and we'll cover that shortly. So as I get down into position, 90-90 comes from a 90-degree hip angle and a 90-degree knee angle. I'm going to put the ball between my knees and it's going to rest there for the moment. Then as I lie down, ideally what I'll have is nice curvature in my neck without having to use a roll. If I feel like my neck is turned on right off the bat, what I'll do is take a towel roll, fill up that curvature of my neck, and I should feel it soften. If you don't feel it soften, feel free to grab a pillow, grab a yoga block, whatever you need to get your neck relaxed. From this position, if we check in on our canister, and if you are unfamiliar with the canister, you should go check out our YouTube video that covers that. So our canister in this position is going to essentially be open through the front. So if I give you a reference here with my hands, what my pelvis has done is tipped forward, and my ribs have essentially flared towards the ceiling because I'm just laying here nice and relaxed. That's going to form this wedge or triangle-like position, where if we put pressure down into a canister this shape, it would want to push out the front. To get a little feedback on that, a demo that I like people to do prior to the drill is to use their hand on their abdomen to try and feel where they're going to push pressure when they're in certain positions. So you're going to have your fingertips on your lower abs, you're going to have your thumb in your back muscles, and the webbing of your hand is going to be in the side of your abs or your obliques. Initially, we want to do the wrong thing, just so we're aware of it. So we're going to arch our back, so hips will stay down on the ground, but it's like we could drive a car right underneath this tunnel for a low back. And while you're in that position, I want you to take a deep breath in. If you notice where air went, feel free, that's your breath. If you need another, take 2 or 3 more and start to notice which fingers fill up with air most. As I hold an arched back position, what you should feel is that your front fingers in your abdominal wall will get almost all of the air expansion or pressure. Your back thumb will get very little of that pressure, and thus it's getting a very minor source of stability. So what we're using this drill to practice is the approximation of your pelvis back into a more neutral or tilted position, and then we're trying to get good at pulling our ribs down so that they just approximate with our pelvis into a more parallel alignment for our canister. If you try and drive your low back down into the ground and tuck your tail hard, what you should feel is on a following breath, air will fill up your fingers differently. You won't feel so much expansion out through the front side of your abs or into your front fingers. You'll feel expansion into your back finger, your thumb. So that's the goal of this drill, is to essentially get good at when we position ourselves, having hamstrings on the bottom here and abdominals, hold our canister closed at the front so we can breathe, and on our inhale, feel pressure fill up our backside. Many of you, if you hold for a few breaths while in this position, will feel your canister essentially empty out of air when you exhale, like it's getting hollow. Our goal throughout this drill will be to keep air in the canister even during exhales. So, to start the drill off, with your feet at that 90-90 position, we've got to learn how to contract hamstrings. So you're going to imagine that you had gum on the bottom of your heel, and the gum's super sticky. So you're going to try and drag your heel down the wall, but it won't move. Instead, it will pull your back pockets towards the ceiling, and you're going to feel your tailbone tilt backwards or lift. We're hoping that your low back stays flat to the ground. This should feel like a relatively minor movement. At that point, we will have approximated that bottom of the canister, so we've gotten half our job done for positioning. Our ribs at that point are the next focus, so I'm going to take one hand just to draw some attention to my ribs, and I'm going to feel how these flared out positions pull down when I reach my hand towards the ceiling, as if I was bringing the lid of the canister down to make it parallel. The other thing that can control our rib line are exhales. You'll use different strategies for different people. Some people might get coached to sigh their exhales out, like they were blowing hot air onto the ceiling. Other people might be cued to purse their lips and more blow their air out through a straw to the ceiling. Either way, the goal is for prolonged, strong exhales to help bring our rib cage from this flared out posture down and in so that we can store pressure. So I'm going to start up a set here, step by step. I'm grabbing hamstrings by digging heels down the wall. I can feel my back flatten to the ground. I'm then going to reach both hands up towards the ceiling. I'm going to accentuate that reach with my shoulder blades peeling off the ground, my head staying heavy, and I can now feel my ribs are pulled down and in. I'm going to take my first easy inhale through my nose. The more silent you can make your inhales, the better you will feel that it fills up the areas we discussed. And now I'm going to make my long exhale out through my mouth after that. You're going to try and pause for 3 seconds, holding that exhaled position. Exhale till you feel abs, and then our goal at the end of that exhale is to not lose the abs as the following inhale comes in. You may have seen in the video at that point that I drive my air into a different portion of my rib cage. I don't take a big belly breath where everything pushes out the front, and I'm going to follow that up with 4 more breaths just the same. So I stay in position, inhale through my nose. And after 5 breaths, I'll relax my hips, relax my hands, and shake loose.